Okay, so today we're interviewing my grandfather, Max McGuire, about his work in the mental health field. Okay, so Grandpa, what facilities did you work at and what years did you work at them?
My first job was in a state hospital, Big Spring State Hospital in Texas. And about the patient, about 700 patients. And the years, I should say, was 61 to 65. Yeah, that's right.
Okay, what was your position at this facility and what did that job entail?
My position, job title was I was the director of chaplaincy. I was a hospital chaplain there. And my duties consisted of directing the department, which didn't amount to too much at that time because I was the only chaplain on the staff, although we had some volunteers. But I also, along with being a chaplain, I was a certified clinical pastoral educator, and that meant that I had students coming in for the summer months from different seminaries across the country, so I supervised them, had daily classes and small group, and the people in the small groups reflected on the work they were doing with the patients and turned in what we called verbatims, and I assessed those, evaluated those. So my work was both as the chaplain. I conducted the Sunday services and did counseling with the patients, and then the education component with several students, as I said earlier. In 1971, we came to Minneapolis, where I became the director of chaplaincy and clinical pastoral education at Abbott Northwestern Hospital. That was a lot of fun because it had never had that program, and didn't even have a chaplaincy department. And I hold the distinction of being the first director of chaplaincy at that institution. And that was a great experience. We had direct access to patients on mental health and the mental health units, and we were that the students could work there as well. So we were well represented. The department was well represented on the mental health units. Because at that time, again, even in as late as 1971, the concept of treating mental illness became part of the whole package of treatment for healthcare. The whole notion of holistic healthcare was coming into being, and that means that we treat not just the psychosis or the depression or the surgical procedure or whatever, but we treat the whole person, physical, mental, and spiritual. So that was pretty exciting to be in a situation like that. And I was there for 22 years and retired in 1993.
What did you like about your job?
Oh, I enjoyed very much working with the patients and with the students too. But I really liked working with patients, and the patients that I saw were not psychotic. So they were patients that we had something to work. I had something to work with. So I really liked that, and Then, of course, I thoroughly enjoyed having the students there for the summer months, and some of the stuff that they were very receptive to learning, both from me and from the patients. But also, I have to say that I have always, had a philosophy in my uh, clinical plan, in my teaching part, and that is that the students learn from me, but I also learned a lot from the students. So that I enjoyed both of those. The part I didn't like was any administrative stuff I had to do. I don't care for that.
Cool. What were some practices that you observed that would no longer be considered ethical or commonplace today?
Uh, Especially at the state hospital, where there were 700 patients. Too frequently, they used electroshock therapy when I don't think it was warranted. And certainly, uh, speaking of ethics, many times the doctors would use electroshock therapy for disciplinary reasons. The patients would act out in some way, and they would get be put on what was called Ward 4 to get electroshock therapy, and that was not needed, and as I say, it was highly unethical. Interestingly enough, the patients had a sense of humor about that, uh, because if a patient was acting out in some way, they would say, "Well, you better watch out. You're going to be up on Ward 4 riding old Sparky." That's what they called it. I suppose that comes from the West Texas culture. I don't know. That was anyway. That stuff was bad stuff. I didn't think that was very good.
Do you have any memorable stories or moments in your career that you'd like to share?
Yes, I do. As a matter of fact, uh, this is the saga of the chaplain getting a patient off the roof. I was the town of Big Spring was not very big, by the way, and neither did it have a spring, so I don't know where they got that name. But nevertheless, it was quite possible to go home for lunch at noon, which I did just about every day. And one day I came back from lunch, and the administration building had been roped off, and a little crowd was standing around looking up at the roof, and the crowd was made up of the administrator and some other staff people. And I walked up and they said, "What's going on here? What's happening?" Well, they said, we'll call him Billy Joe. Billy Joe's up on the roof and he's throwing slate shingles. And those slate shingles were sailing through the air and going through car windshields, and it was a danger to people walking by. So Billy Joe had to come down, but how are we going to get him down? And the administrator turned to me and said, "Chaplain, go get Billy Joe down off the roof." And I very reluctantly said, "Well, okay," but knowing that none of my previous training during residencies at the Vinegar Foundation in Topeka and Topeka State Hospital, did not train me to get folks down off the roof. So I went up to the second floor, and there was a walkout at the end of the corridor on the second floor, and that's how Billy Joe got up there in the first place. Anyway, I strolled out there. It was July in West Texas. It was probably about 110. And here was Billy Joe sitting up at the peak of the roof, pulling off those shingles and sailing them through the air. And so I crawled up there, and Billy Joe says, "What are you doing up here?" I said, "Oh, nothing, Billy Joe. It's noon, and I just wanted to come up and get a little fresh air, uh, which was so absurd because it was, like I say, it was about 110. Well, he said, "You're not going to get me down." I said, "Okay, we'll just sit here and visit for a while." So we talked about nothing, and I was stalling for time because I knew Billy Joe was getting as hot as I was, and I figured he'd come around pretty soon. But I hit on an idea, and I was a smoker at the time, smoked cigarettes, and I said, so I'd reached in my pocket and got a cigarette, my cigarette pack out, and I took one and I said, "Billy Joe, you want a cigarette?" And he said, "Yeah." So I gave him a cigarette, and he waited, and finally he said, uh, "I have to have a light." And I said, "I don't have any matches with me." He said, "Well, go down to your office and get some." No, I said, "I tell you what, you come down to my office with me. It's cool down there, and I'll buy you a Coke, and we'll sit in my office and have it smoking a Coke and talk." I said, "It's sure a lot more comfortable sitting up here in this hot sun." And no, he didn't like that idea. He said, "You go down and get him." He saw that I was not going to go down there. So finally he caved in and he said, "Okay, let's go down to my office." But he said, "They'll put me up on Ward 4, right nose Sparky." And I said, "No," I said, I'll see to it that they don't do that." So that's the saga of getting Billy Joe down off the roof. He came down off the roof, and we did go into my office where it was cool and I had a Coke and a smoke. Another, I don't know if it's a story, but it's one of the. I tried to intervene to these unethical things as much as I could, and sometimes I had to do it kind of behind the scenes because I was could have been seen as somebody who was trying to direct their treatment, and I could not do that, of course. But we had a lesbian, and she was there. Unfortunately, see, this is back in early '60s, 61, 62, 63, going, and not much was understood or known about gay and lesbian folks, and certainly in West Texas, not much was known about them. As a matter of fact, it was almost cruel the way a gay or lesbian person would be treated outside, just in the community, let alone one that's in the state hospital. And that, as a matter of fact, that's why she was admitted to the state hospital on the basis of her sexual orientation. And she was really a delightful person. She was a very bright person, and every once in a while, she'd get caught with seducing a patient. Well, yes, of course she did. And then they put her up on Ward 4, and so I went to the head psychologist, and I said, I did some research, and I found out that this woman comes from a family of means, has good financial resources. And I said, let's try to get her transferred to Medicars in Topeka. I said, they know what to do about this. And sometimes, a lot of times, maybe most of the time, I don't know, to do nothing. But I wanted to get her out of that environment and out of that culture. And so we went to the superintendent of the hospital and petitioned him to have her transferred to Medicars in Topeka. And he had been there himself in a training program they had for hospital administrators, just like they did the program for chaplains. And so he was quite open to transferring this person to Vinegar in Topeka, and they transferred her, got her out of that situation. And I think probably I didn't have a follow up with her, but I'm hoping that she probably spent 2 or 3 weeks at Vinegar's, and they discharged her. Would be my guess.
Okay, so do you feel that treatments for mental health have improved in recent years? Why not? And how do you think we could continue to improve?
Yes, I think mental health has improved greatly since the day I started working in mental health. Gosh, I remember this was in the late 50s. The only psychotropic drugs they had was Thorazine, and that was a terrible drug. It was an antipsychotic drug, and so they couldn't use it. But they had to use it rather sparingly. But sometimes they didn't do that. They were a little abusive with it. So, but anyway, my point is that that's all they had to work with in terms of medication. And now, of course, we have Prozac and all kinds of stuff that they use, and thank goodness. So yeah, there's been a big change, and for the better. We're still a ways to go, but it's a big change.
What is one piece of advice you'd give to anyone looking to have a career in the mental health field?
Oh, I would say go for it. I think it's a wonderful field, and we need a lot of folks in that field who are interested and excited about working with mental health, because the demand is increasing, partly due to the whole drug scene now. But that is, I think, is mental health related, although they have a very specific treatment plan for drugs, alcohol, and so on. But I think they would. I think they're needed. I think a lot of staff is going to be needed to meet the demands of, hopefully, the mental health programs in this country are going to open up more than they have been.
Okay, so our second interviewee of the day is my grandmother, Martha McGuire. So, Grandma, what facilities did you work at, and what years did you work there?
I worked at Topeka State Hospital in Topeka, Kansas. In 1979, the first 5 months. 1959, the first 5 months.
Okay. What was your position at this facility, and what were your duties?
I worked as an assistant in occupational therapy, and my duties were to just be present in the occupational therapy room with the patients when they would come in, and sit with them at a table where we did craft work. Much of the craft work was work that I had never done. I had no background in either occupational therapy or mental health. My background was in music, so this was quite a new thing for me. And I was not a craftsperson, but I did the job, and I had a good time. The patients taught me everything. I didn't teach them. It was just kind of backwards, but it was kind of unique in that way.
What did you like about your job?
It was hard to say because it was very difficult. I'm not sure that there were things that I liked, but there were things that were more pleasant than others. Some of them were, I really did enjoy working with the patients and learning from them. We had a good time together.
What did you dislike about your job?
The atmosphere was very strange. I'd never been in that setting before, that kind of setting before. And it was dreary. Huge campus, big stone buildings, a cold feeling. Many of the patients were dressed very poorly and looked very unhappy and seemed to be doing strange things. So the atmosphere in those regards was not the best.
What was it like to actually live on the hospital campus?
That was actually fun. We lived in a dormitory, one room, one bedroom. We shared a bath with the next neighbor, a man. I've forgotten what his field was. These were all professional people who lived there. The dorm was for people who were studying at Topeka State Hospital, as was my husband, a chaplain. Our best friends were people like a dentist from Denmark and his wife, psychiatrist from, I've forgotten which country, but most of them were from other countries. So it was like a little UN building, and we had a lot of wonderful experience there.